Hey, Carrie.
Hey, Adrian.
What do you do here as a surgeon at UBC?
Okay, I'm a pediatric surgeon at BC Children's, and I'm also the co-director of Mentorship and Wellness for UBC Orthopaedics.
What is something that you wish you had known at the beginning of your career that you know now?
In the beginning of my career, I had this view that you're going to go to one place, you're going to work there your whole career, and that's what you're going to do. And it seemed like this momentous decision to try to decide kind of where you were going to go. I've since learned that that's actually not necessarily the case. Understanding that you can pivot, you can go different places, you can do different things. I think in understanding that potential flexibility, I wished I had known because I wouldn't have been so stressed about making the exact perfect decision early on in my career.
You've been around to several locations, so tell us about your journey and tell us about maybe what you learned in each stop.
I did my residency training in Calgary, and then I went to Melbourne, Australia for fellowships in limb deformity reconstruction and then pediatric orthopedics. And then I actually ended up taking a job regionally in southern Alberta in Lethbridge, and I actually worked there for 7 years. I had great colleagues and had a great opportunity invited back to Melbourne, Australia. So then I went there for 5 years, and that was in a tertiary pediatric center. So really kind of swing from one extreme to the other. And then I've recently come back to Canada working in another tertiary center.
Was there anything you picked up in particular in each spot?
Regionally, I think it was an amazing time because I really got to build my adult trauma skills and was able to make sort of impacts in terms of quality improvement, things that were kind of easier to get done in a smaller center compared to like rage against the big machine. And I built a lot of like skills and advocacy and things in that era that are extremely valuable. In the tertiary sort of setting, that was a bit different. You have different bureaucracies, you have different challenges. In that case, it was also a different country. So learning how to navigate that and understanding kind of finding your allies in and outside of your specialty to get things done, I think was really valuable. And then here, well, I've only been here 4 months. So.
Yeah, to be determined.
Yeah.
Do you have someone you consider a mentor, and what was their effect on your career?
Probably the person that stands out the most to me. I've had many people influence me over the years, but his name is Chris Harris. So he's a surgeon in Australia. I always found him amazing because he not only was a technically highly skilled surgeon, he was so empathetic to the patient. And I think that combination was really special. And I think a lot of the way I tried to kind of early in practice, try to kind of model based on what I saw him doing with patients.
And finally, talk to us, have you had any, in terms of wellness, orthopedic injuries throughout your career?
Well, I did have an issue about 5 years ago where I was trying to use a wire cutter that was really quite dull, and I was squeezing really hard instead of asking for a better one.
Yeah.
And ended up giving myself tennis elbow for like 6 months. So I was having trouble like turning screws and things. So I learned to make sure I asked for the right equipment rather than just sort of like putting up with stuff that's not great.
Thank you so much. So excited to have you. It's awesome.